As the seventh COVID wave continues, people can start rolling up their sleeves again. Ontario's Chief Medical Officer of Health is expanding eligibility for fourth shots for anyone 18 and up starting tomorrow. But does everyone need another booster? Not necessarily.
It's not an obligation to get a booster dose if you're young and healthy and have no underlying risk to this virus. We know your risk of hospitalization is low.
The highly contagious BA.5 is now the dominant strain in Ontario and fueling the current wave, which Dr. Moore expects to peak in the next 2 weeks. He believes there are roughly 5,000 new daily cases in Ontario and that vulnerable people are the ones who need to get another booster.
My real call to arms from 18 to 59 is anyone that has an underlying illness.
Anyone 18 and up is eligible, though, as long as it's been 5 months since their last shot or 3 months since a COVID infection. Dr. Moore says getting one now will not interfere with getting a fall COVID vaccine, which will likely give better protection against Omicron. If you get a booster now, you may need to wait 5 months to get another vaccine, 3 months if you're immune compromised.
The crusade continues.
Today, Toronto Mayor John Tory says the city is ready to administer fourth doses.
We have the city-run clinics, we have doctors' offices, we have mobile clinics, we have school clinics, we have pop-up clinics. We will continue with all of those. So for this weekend, for example, we're going to be at the Honda Indy. We're going to be where people are.
Approximately 1.8 million people in Toronto will now be eligible for a fourth dose, but the messaging of whether one could be confusing. Toronto's medical officer of health had this advice for those wondering if they should get it now or wait until the fall.
What kinds of exposures might they have? How often might they be exposed to COVID as a result of their work or their life circumstances? Who are you exposing? Are you in close and regular contact with somebody who is immune compromised or who is at higher risk?
So all things to consider when you decide if you're going to get that extra booster. Now, if you are immune compromised and already have had a fourth shot, Dr. Moore says you can get a fifth. But if you haven't had your third shot yet, and 5 million in Ontario have not, he's strongly encouraging you to do so and says people should consider masking in crowded indoor areas. As for the free rapid tests in pharmacies and grocery stores, that program was set to expire at the end of this month. It will now continue until at least the end of the year.